So we are now starting with the chapter determination of dose and dosing interval. And this is again interesting chapter because many times you see patients receiving one drug at particular dose, then same drug at different dose, and even frequency. There is change in frequency, and many times you might be wondering, okay, how this frequency is fixed, why some drugs are BID and why some drugs are TID, why same drugs becomes BID and same drugs become TID in different circumstances. Okay, and you also see the drugs at different doses have different indication. So all those you will get clarity to an extent in those queries when you read this chapter. Okay, when you understand this chapter. So I think this chapter is very important when it comes to extrapolation into the clinical aspect when you go to the ward and then see how the dose is made and how the regimen actually how the frequency is fixed. Okay, so and this is important to understand in that context. And many of the things you know already. That's why this chapter will not take a long time for me to complete. And this all I have to do is assimilate those staggered information into one place and then make you understand and make sense, and then I should make you to make sense about what you already know and how to extrapolate this. Okay, so for example, you already know that why we give a drug to achieve a therapeutic level. Okay, there is a minimum toxic concentration, minimum effective concentration, maximum safe concentration, or there is a therapeutic window. You know that. Okay, and we know that for a drug to work appropriately, the drug should be in therapeutic range. If it is below that, it is not going to work. If it is above that, the patient is going to have side effects. So this is what we call as CSS, and here many terminology will come, and I think it will be again easier for you people because you people already read about C max and C minimum, like trough and crest, all those things in the TDM. So again, that will be easier for you to understand. So the how the we have also talked about what how we do loading, how we give loading dose and how we give maintenance dose, right? We have talked like loading dose depends on what and maintenance dose depends on what. Loading dose depends on
Volume of
yes,
distribution.
yes. Maintenance dose depends on clearance. So we have talked all those things. We will just simulate this and then understand in better way here. So the objective of giving a dose is to deliver a target. Okay, whatever there is, again this target is different for each disease actually. That is why in different disease we have to give different dose. Okay, you see that the aspirin have multiple indication. Okay, but it and a different dose because the disease is different, the desired concentration is different. Okay, the desired amount of drug required in that disease is different. So that is why we give the same drug at different doses. Okay, and we cover multiple indication of the same drug. So I think you remember from your last year kinetic, this is the equation for calculating C average. You remember? Okay, this is nothing new. Okay, this is again from your old last year only. Okay, this is the formula to calculate CSS average. Okay, the average concentration, average plasma concentration of a drug. Where if you have so here tau, the denominator. Are you seeing this? A tau. Okay, tau is duration, like frequency, how often you are giving. Okay, and like dosing interval. Okay, like if it is 2 hour or 4 hour after like you write no Q8 hour or Q4 hour. So that is, so T half, you know, there is a T half of a drug, elimination half of a drug. Half, you know, that's a biology. Okay, if you are giving it through oral form, not through injection form, and BD is the volume distribution of drug, and B0 is the dose, the amount of drug that you give in milligram or gram, whatever. So so if you do this calculation, you will get the average plasma concentration. So this is the formula to calculate average plasma concentration, and I think you know already from your last year. So you should know this formula. Okay. And then since here we have frequency here, tau, and we have D0 here, we can manipulate this equation and get the D0. For example, you don't know how much drug, how much dose you should give, right? D0 you don't know, but you know how much C average you need. That means what is my target concentration for this disease, you know that. but you don't know how much dose you should give. So and you have other parameter. You have the value of other parameter like volume distribution, you have, and biology, and duration and frequency. So then you can easily calculate D0, isn't it? If you have all other things, okay, except D0, which is dose, you can calculate other parameter, isn't it?
Yes, sir.
Okay, so this is one exercise. You can see what I was talking about. For example, here they are telling they have given you some data for which volume distribution is they have given, okay, and they are asking you to calculate. This is just for practice. You have to calculate the C average, that's steady state concentration of drug, and the dose is 150 milligram. Here you have been given the dose, but you have not been given the target concentration. You don't know target steady state concentration. So once you put all this value, you get the target steady state concentration of 2.3 microgram per ml. So this is just exercise to calculate C average here. Okay, that's steady state concentration. And here in this example, you are supposed to calculate the dose. So here they are teaching you how to calculate the dose. Here you have been given everything, but you have not given you have been given D0. Here you can see here you have been given a C average, that's a 2.5 microgram per ml, that's the target therapeutic concentration, and then you have been given the dose. You can see here the dose is 2 point the dose is, sorry, dose we are calculating, okay, dose we are calculating, and you have been given the T half, okay, T half you can see here 2.15 hour, right? And then distribution you have uh, and then you have like just to calculate the volume. Every 8 hours is the duration, okay, and this is the way to calculate the volume distribution, okay, because here it's 80 kg individual, and then 33.5% of the body weight is the volume distribution. It is the reported from literature. So if you do that, then and the D0 is calculated to be 173 milligram. Okay, so we are not knowing how much dose we should give, but we had all other parameters based on which we calculated the D0. Of course, in a clinical scenario, when you go into ward, you may not have all the data, but you have to get back to the literature and see just to practice yourself, because everything is calculated. That's why they are practicing that. But if you do retrospectively, it will give you better insight about this aspect. Okay, is that clear? Am I audible?
Yes, sir. Yes, sir.
Okay. So you know that the bactericidal concentration of antibiotic varies in organism. For some organism we give it high dose. For some other organism which is less virulent, we give it low dose. And we have a peak and trough level. I hope you know that peak is the highest concentration of a drug, and trough is the lowest concentration of drug. And sometimes we depend on this peak and trough level very heavily, okay, to understand the blood concentration of drug. You see in many TDM, the TDM of many drug, in the TDM of many drug, they take the peak concentration of drug, or they take the trough concentration of drug. Especially for example, for antibiotic, they will go for the trough level. So but what actually, if you think logically, these peak and trough level are less useful pharmacokinetically, okay. But why I'm telling this is because they often fluctuate based on the amount of dose that you give to the patient. What does that mean is, if you give a high dose to the patient, the peak concentration may go high, and um, again, if it has short half life, it can fall down very quickly. Or if the patient have missed the dose, or if the patient have taken low dose, the trough may be very low. But our effect, the pharmacological effect, doesn't simply depend on peak and trough, but it depends on what? It depends on what? Tell me. Hello? Am I audible?
Yes, sir.
The pharmacological effect doesn't depend only on peak and trough. It depends on what? We already discussed now.
Half life.
Okay, but in terms of drug concentration, I'm asking, not in terms of drug properties, but in terms of drug concentration in the blood. Right, as I told, it doesn't depend on peak and trough, but it depends on concentration. Right? That's what we discussed, the target drug concentration. Clear?
Sir, can you come? Sir, can you come again?
It doesn't. I'm not asking in terms of drug properties, drug kinetic properties. I'm asking in terms of the plasma concentration of a drug. For example, here I told you it doesn't simply depend on peak and trough. It depends on the average of that. Okay, that is steady state plasma concentration. Did you get it?
Okay, sir. Yeah, okay, sir.
So that means when we use the average plasma concentration as therapeutic indicator, that gives a more clear picture of like how what should be the dosing interval set between the drugs. Okay, all those things it will be easier. And when it comes to dosing interval, actually it becomes the elimination half-life becomes the important kinetic parameter. But again, here is a warning for you people. You people doesn't just generalize that, okay, if just based on elimination half-life, you just don't go fixing the frequency, okay. This applies only to those drugs which have narrow therapeutic drug, okay. The dosing interval is usually set at approximately 1 to 2 elimination half-life of the drug, unless the drug has a very narrow therapeutic index drug. Okay? If the drug have very narrow therapeutic index drug, then it is not used. Okay. If it is wide therapeutic index drug, then you can go for a 1 to 2 elimination half-life, the frequency, the interval. Are you getting it? Hello?
Yes, sir.
Yes, sir.
Yes, sir.
Then let us remaining for this meeting. Okay, you can see my screen, right?
Sir.
Still see my PDF.
Yes, sir.
Are you seeing it? Because I clicked on that upgrade meeting time and I went somewhere and then I went to.
We can see, sir.
So in such cases, what
Like
you have to do is you have to give a drug in small doses but more frequently. Okay. That means if the drug is narrow therapeutic index drug, you give small dose because why you should give small dose on the narrow therapeutic index drug?
Can go to toxic level easily.
Yeah, the peak will be the peak can go very up. Okay, so because this is a narrow therapeutic index, you cannot give at high dose. So you are giving at low dose. For example, you might have seen in case of digoxin and phenytoin and all those narrow therapeutic index drug, you can understand from that. You give it very low dose, but the frequency you increase so that it doesn't go beyond the peak and it maintains in the concentration in therapeutic window, that is steady state plasma concentration is maintained. Did you get the idea of fixing the frequency of narrow therapeutic index drug?
Yes, sir.
Yes, sir.
We'll take one example. Okay, no issue. With the example, it will be clear. But when it comes to the wide therapeutic index drug, we give at higher dose, and we because that's a wide therapeutic index drug, we are not very concerned about getting toxicity because the drug is considered as safe. And we also increase the frequency. We also decrease the frequency. That means we also increase the interval. Okay. So. So let us take one example here. It's given here. So what is the effect of changing dose and dosing interval on C max, C minimum, and average? Actually, we discussed already now here. As I told, if you give at higher dose, C max will be higher. If you so what you should do in which kind, like if the drug is narrow therapeutic index drug, what strategy you should use? If the drug is wide therapeutic index drug, what strategy you should use? So so CSS is important parameter, we all know. Okay. And for many drugs, I told serum trough concentration or C minimum is also called as serum trough concentration. Trough is the lowest amount of concentration. That's the C minimum amount of concentration. So they often depend on this C minimum to validate the dosage regimen. Okay, and for that they just take the blood sample immediately prior to the next dose, okay, to obtain the C minimum, okay, because at that time, just before the next dose, the concentration of previous drug has gone low, okay, so that is why we give that. we take the sample just before the previous dose. But to obtain a Cmax, the blood sample is drawn exactly at the time of peak absorption. Okay, and based on this, we space them. Based on this fact, we space and we give a recommendation when the sample has to be taken. But you all know that the absorption, what are the factors that can affect absorption? I think in the last year from 20 was a 10-mark question for you people. There are many factors that can affect the absorption. So it's not practically very good to depend on this factor, depend on this parameter. And there is various factor that there is various difference in the rates of absorption. So so Cmax, if you measure in this way, may not give you the correct Cmax, but it is an approximation of the Cmax. Okay, and so I told you now the problem with the Cmax and the problem with the C minimum, but C average. If you see C average, I think now you can appreciate that C average is the ideal parameter compared to the Cmax and C minimum to adjust the dose, to calculate the dose. Okay, if you use the C average, then you didn't have to worry about the fluctuation that happens with the Cmax and C minimum. Cmax sometimes can go above the therapeutic, above the toxic concentration as well, and C minimum can go lot lower than the required concentration. So, these are the problem with the Cmax and C minimum, and we can go for the C average. Okay. So I think shall I have to give the example to understand, to make you understand the C minimum and C average. For example, shall I have to give the example to make you understand how C minimum and C maximum can cause bias?
Yes, sir.
Okay. Now let me give you. Tell me a number. Tell me a number. Let's say 100. Okay. Let's say 100. So 100 is the. Tell me the average of the two number. Sorry. Tell me the two number whose average will be 100.
150. 150 and 50. Sir.
Okay. 150. Sarath is telling 150 and 50 is 300 divided by 150 plus 50 is 200 divided by 2 is 100, right?
Yes,
Right.
sir.
Yes, sir.
So that's the average of 150 and let me use my whiteboard.
50.
That's the average of 150. Can you see my whiteboard?
Okay.
Okay, that's the average of 150 and 50. Okay, let's say this is our C max. Okay, this is our C max, and this is our C minimum. Okay, so can you give so the average of this is 100, right? Can you give me some other example, other number whose average will be 100? Are you following me? Hello.
Yes, sir.
Yes, sir.
So there can be many combinations. You have to know that there can be 175 plus 25 also, isn't it?
Yes, sir.
Yes.
Still the average going to be 100. Okay. So this is C average. This 100 is the C average that we want. Okay. And these are C minimum and C maximum. This C minimum, this is C maximum. So see, though the C max and C minimum, like here you can see the C minimum is just 25, okay, and C max is 175. The target therapeutic concentration that we need is, and the average steady concentration is 100. So here, what I'm trying to tell is that see how all the conditions have 100 only C average. C max and C minimum are different. Are you understanding?
Yes,
Yes.
So we cannot heavily depend on C max and C minimum, okay, to calculate the dose, okay. But if you have a general idea of at least C average, then you can depend on this, okay. Did you get what I'm trying to tell? Is it confusing?
Yes, sir.
Is it confusing? Hello?
No, sir. No, sir.
Then I will try to explain it further. If someone is finding it confusing, please tell.
No, sir, this is fine.
This is what we want. Okay, this is what is giving us effect. See average. Okay, this is
Yeah.
not giving us effect. These things is just those what it is the thing that this is just the immediate picture. Okay, the C max and the C minimum. But what we need is the C average. Okay, if you see the graph also, this is the peak, this is the trough, this is the peak, this is the trough. We need the concentration in between these. We don't need the concentration here and we don't need the concentration here. The concentration in between which is going to show us effect. Is that clear?
Yes, sir.
Okay.
Yes, sir.
So I think we have less than 1 minute. What to do? Shall I continue in the next class? That's all for today. Because the important concept is coming now, so I thought I will explain that nicely so that you can understand. Shall we take tomorrow?
Okay.
Okay, sir.
Okay, sir.
Okay, thank you. Thank you all. Have a good day.